Had a very odd experience here in New York. Somebody pulled over. I thought I finally made it. Some guy jumped out of a car and wanted my autograph, and thought I was Jerry Springer. I'm not kidding. It was really fun. Well, we've got a great group here to discuss, broadly the questions of what's happening in the data world with regard to health, communities, how we think of ourselves and our identity. And as we've gone into this, I've always started out wondering out whether the increased data, our sense of being able to measure empirically what's happening, is going to make us happier people or not, or whether it's going to make us all miserable when we make up. I was reading about Esther Dyson's life this morning, and she's a friend for a long time, but I literally did not know that since she was 18 years old, she's swum every day. That is staggering and depressing.
It's inspiring.
Yeah, it's inspiring. I mean, it should be inspiring, but it's depressing. Allow me to be a little depressed, but because that helps get me out of maybe into the pool one day. But Esther, is data going to make us happier?
No, I think it's going to give us more power to make ourselves happier or sadder. But it's what data does right now. The world is becoming incredibly short term, and we're using data for next quarter, for next election, watching things go up and down. And what we should be using data for is to think long term, because if you understand the data well enough, you can make much better predictions. So, for example, I can go into a grade school and I can predict that 2/3 of the kids are going to end up unhealthy by looking at the food they're eating. I don't need a lot of personalization. I don't need genetics. I just need a trust in the data that says that kids who've been eating this stuff for the past increasingly 20 years have turned out badly in terms of health. I can predict what's going to happen to this set. And I don't need to do a trial or a scale, a pilot, to know that what people are eating today is making them sick.
Well, I assume that to some degree, I don't want to trumpet our underwriters think the same thing, that what goes in comes out, that if you begin looking at, what children eat, what their nutritional issues are, that we'd have it. But yet there's something about you saying that seems like many people to be alchemy, like that you're somehow able to see things I mean, I know you're talking about science and empiricism, but there's sort of a doubt or disbelief, because wouldn't it be easier if you've got clear data on what would make healthier children more broadly? Why is it such a hard lift to make that happen?
Because people like sugar, because bad
the data
food
shows.
Yeah, bad food. Bad food tends to be more convenient, processed food, cheaper, especially in a world where we subsidize sugar. Mm-hmm. And I don't want to get off on that totally, but back to your original question, to me, the real purpose of data is being able to predict and showing how you can improve things long term, because most of what creates health, for better or worse, is long term. It's not take a pill and you're healthy the next day, and it's also not eat bad food and you're unhealthy the next day, which is why not just data, but data science and a public that's well educated enough to believe it, which is really key.
So, Chris, before I get, because you're way too much fun, we're going to get you in a second. But Alan, you with Vitality, as I understand it, I would love you to take us down there. You've thought a little bit about how to influence, sort of, I would almost call it behavioral engineering of connecting people's aspirations to data and rewarding them with points. And I am a points guy. I have points for everything, and I really want to know how you're going to change my life with points.
Sure, and I think this is one of the real difficulties that we grapple with, is behavior change, because the data is showing at a more of a society level. You can see what the right things are to do and what the effects of doing it is. But how do you actually get individuals on the ground to change their behavior? And it's a function of many things. One is just knowledge. So we often overestimate people's knowledge of what it takes or what they should be doing. Not everybody knows the basics, and it's about informing them about what they should be doing. But that's becoming less of a problem because most people are becoming more aware. It's how do you get people to change their behavior? So we have at Vitality, we have a points-based system which incentivizes people to live healthier lives. And it really is pretty basic in terms of what you need to do. It sounds basic. It's get active, be screened, have the proper preventive screening, eat healthier, stop smoking. These are...
So far, that sounds really boring.
Right, but we make it fun to get there, and that's the whole thing.
Yeah. So how do you make it
because
fun?
These are boring, and they're often things that people don't want to do. So what we do is we have to put in place disruptors, and one of the chief disruptors we put in place is an incentive system. So we get people to do things and be rewarded for doing it. Get more physically active and be rewarded for achieving manageable goals, so walking a certain number of steps per day, having that gym workout, and slowly increasing that, getting people onto a road towards being more active and better health. And the rewards take a number of different forms. Typically, it would be in the form of gift cards, vouchers, other aspirational rewards. We have the concept of a vitality status, which is like a frequent flyer status, so people aspire to it, but there's a competitive aspect to it, and you get more rewards as you go up your statuses. It has a remarkable effect. People, as you pointed out yourself, people do get competitive and do like to accumulate points and achieve higher statuses, and we're seeing behavior change come from that.
So are you attached to it? I mean, how do I get gift cards? So how do I have to buy my own gift card?
No. You would earn them. So you would earn them through your activity.
I see. And then does the insurance company provide that gift card?
It's either the insurance company. So we do work with we're with John Hancock. So life insurance, as the life insurer, have got a real interest in getting you healthier. The longer you live, the more you'll be paying your premiums, and the less they'll be paying out. So it's really a win-win situation. So those incentives are in place. Or the employer. So the employer also has an incentive to keep you healthier. You cost less by way of healthcare claims, but more importantly, you're a more productive and happier employee.
So what vices do you have?
Personal vices.
Yeah.
I thought this wasn't a Jerry Springer show. But
well, let me put it another way. Are you in your points program? Because you seem very healthy to me, and you seem like you're probably doing everything right.
Absolutely. I'm a proud platinum member of our points program.
Right. Yeah.
Which essentially means
so
that
if you've achieved all your goals, why do you keep doing it? I mean, in other words, does the point system have a point of diminishing returns?
You have to keep on re-earning your status.
Oh, I see.
Correct. So your status will hold for a certain number of time, and after a year, you'll lose it if you don't maintain it. So there is incentive to keep doing it. And I must be honest, if it weren't for the rewards program, I probably would be less active. I'm very conscious about the amount of physical activity that I need to do because I've got targets, and they're measurable. The array of devices out there and just the tools that are available now to give instant feedback, it makes it, if you engage in it, it really makes it achievable and much easier to achieve a healthier lifestyle.
Chris, would you be happy in a points world? Do you want to join Vitality's frequent flyer program?
I would join it, but I don't think it's sustained change. I mean, the reality is that anything, you can see it in anything, right? I mean, when you offer people incentives to do something, they only want to do it unless the incentives are there. So the reality is they have to see a benefit to doing it for themselves long term, and it has to be beyond it. Even with the point system, I get frustrated with the airlines because I have to renew it every year, right? And I think that I'm more of a stick approach, the carrot to start it, to initiate it, but then the stick to sustain it. And I think once people actually are penalized for something...
So you want to be penalized for...
I don't want to be penalized, but I think it creates a sustained change in behavioral changes for people in most cases.
This is a deeply philosophical discussion going on here. Yeah, Esther?
So, just forgive me, but how many of you ate the pastries or the cakes this morning? Did any of you think that they were healthy? Okay, so
That's a brave man back there.
It's not just, like people get a Fitbit and behave. It's also the environment around them that either supports them or it leads them astray.
She's hitting on a key point, right? So I think the big thing is about, and I hope that you get to this at some point, of talking about the social determinants of health.
Right.
So it's one thing to say behavioral change, but there's also the environmental factors that influence actual health of an individual too, that I don't think that we're discussing enough. Whether it be socioeconomic factors, is it safe for me to walk outside my house and jog, or is there a pool available for me to swim every day? Probably not.
I can introduce you to the Y, in fact, 2 blocks away.
Well, in that case, all right. And so, I mean, I think those are all contributing factors to the health of an individual. And I think that's where we are in an exciting time, because people are considering that. Whereas before it was, you are not healthy because you aren't doing the right things, when there are other factors that
community
contribute.
Factors. Well, you know, we were down with Blue Cross Blue Shield in Louisiana, and we were looking a lot at the question of obesity and diabetes and other sort of chronic problems in that particular state. It's all across the country, but you know, particularly there. And these social determinants were a huge part of that. But while there may be increasing awareness of that, these seem to be very big, hard needles to push in terms of it. But let's go into the broader issue of just data in general, because Chris, your company essentially is a big pioneer and embracing very dramatically, knocking down all the walls, if you will, against those that have been trying to sort of enclose data and to try to bring it in and use it. You know, kind of give us a quick snapshot of what your mission is as you see it.
Well, the Health Data Consortium started off, it was a spin-off from the Department of Health and Human Services. The idea was that under President Obama's administration, he wanted to make government more transparent, but he also wanted to create disruptive innovations using government data. So that's where you started to see the whole open data movement. Now, when it comes to open health data, HHS realized that they had so many data sets that could be of value that could actually disrupt the industry as well and actually improve or address these cost issues and quality issues. So this organization was formed to promote the use of those data sets, as well as encourage people that data sharing is okay. So the greater systemic challenges we have in healthcare as it relates to health data is just more cultural, right? I mean, most people are making it technological, saying interoperability and all these things, which are challenges. I mean, don't get me wrong, but I think it's more that the technical challenges can be addressed, and it's more of getting people to buy into the philosophy of using
Who's in your consortium?
We represent the public and private sector, so we do have, HHS is actually a member, but then we consider ourselves to be a multi-stakeholder organization, so we do payers, providers, technologists, startup companies, and even pharma that we engage with, which is often left out.
So you say pharma like you know, it's Darth Vader out there.
They're viewed that way.
Yeah.
I think because they're viewed, they're perceived as if they're only after their own capital gain and self-interest, which I'm not going to say is not the case in some cases, but I do believe at this point to complete the ecosystem, they have to be involved.
So my experience when you bring together a lot of stakeholders in a project like yours, some are very enlightened and some are not. So who are the best advocates in your consortium for what you're doing, and who are the sticks in the mud?
I think the best advocates are always going to be the consumers, right? The patients, because they want access to their data more so than ever before. It used to be highly paternalistic, where if I went to the physician and they said, take 2 of these and call me in the morning, I would just do it. But I think more people now are realizing that they have side effects from certain medications and they want to take more ownership of their own care needs. So the consumers and the patients are demanding it. And as we can continue to build that groundswell, then I think that we'll see the cultural change that we need to.
So who are the worst players?
The worst players are those that you're going to ask me this very targeted question. And to be totally honest, I think I'm going to say some providers and some payers, you know, because when you have more access to data, then there's more transparency. And there's also a more informed decision that takes place, and not everyone sees the mutual benefit in people making those types of decisions. For example, if I went to my provider and said that I was Googling and I was on WebMD and looking up seasonal allergies, he probably wouldn't like the idea of me telling him what I think I should be receiving for medication rather than the other way, or vice versa.
Alan, Esther, let me ask you both, just, given the way we are seeing technology race forward, our really relationship with technology and the space, particularly in the health space, change. I guess the question I have is do you think that the specificity and precision that one around a patient and a patient's journey through a smart healthcare system is really improving? Because to me, it still looks like the Wild West. I mean, I feel as if there's an incredible amount of opaqueness, opacity, and of inconsistency, despite the data world we're in. And I'd love to get because you invest in this stuff, Esther.
Yeah.
How do you see it from the individual patient's view?
From the individual patient's point of view, how shall I say, at one end, it's amazing if you have enlightened providers and you yourself are technically capable and also slightly pushy. If you're not, it's just the way it used to be. I spent half a day with a doctor in Muskegon for which I had to have a chest x-ray to make sure I didn't have TB and so forth. But talking to patients and, people have busy lives. What the health system doesn't really understand is that it's not one drug competing against another drug. It's one drug competing against a drink at the bar, or maybe getting your car fixed, or your kids' shoes for school. And so they've got busy lives. When things get too bad, they go to the doctor. The doctor tells them what to do, and they do it. And they worry about being sick, and they worry about their medical bills. But life is complicated enough that many people don't want all this information. Now, the challenge is it actually would be useful if they had it. Just the same way if you have a budget, you can reduce your taxes. If you understand
Which are due today, by the way, if you had an extension.
Yeah.
I just want to let you know it's on my mind.
That's mine too.
Yeah.
But if you understand your body and the environment around it, you can invest in health as an asset. It's something that actually pays off, whether for you or your employer. It's resilience. It's the ability to handle. You get the flu, you bounce back in 2 days. Well, you should have taken your flu shot, but you bounce back in 2 days. You get dementia, but at least you're a healthy weight. You don't have 3 other medical problems as well. Whatever happens to you, you're better off if you've got this health asset to help you cope with it. And that's individuals, communities, the United States at large. And that's why data is so exciting, because you need data to understand the value of that asset, because it's not tangible. And neither individuals nor, frankly, communities, nor employers, nor most of the U.S. Congress understands this concept. But health really is an asset, and that's what accountable care is about, in a sense. It's investing in health, not spending on care.
Can you take us down? I've been reading a little bit about what you've been writing about the quantified community, and what a quantified community looks like and feels like. Where does health provision fit into that? What are the pieces of it?
I founded something that ended up being called the Way to Wellville 2 years ago, and we're working with 5 communities that asked us to help them. It's not a nice white lady from New York is here to tell you how to live, but more, we've got a coalition in our small town so that you can find out.
So these are 5 communities that want to be Wellvilles.
Yes. And
are these public, or are you keeping them secret?
Oh, no. They're, and maybe someone is from one of them and wants to help out. Muskegon, Michigan, Niagara Falls, New York, Clatsop County, Oregon, Lake County, California, and Spartanburg, South Carolina.
Cool. If anyone's here, that would be so interesting.
Yeah. And they're
but
small,
those are 5 small communities that are trying to
self-contained.
change the game for themselves. So how do they? What do they have to do that?
It's very simple. No scientific experiments. No genotyping. Just healthier food, prenatal care, early childhood education. Again, proper food, both then and in school. Obesity/diabetes prevention programs and mitigation programs. And then you do the traditional Tulgawande, go after the heavy the heavy cost people with multiple chronic conditions and just deal with them more effectively by giving them coordinated care. And you will save tons of money.
Are they measuring outcomes?
Yeah, and the whole point is to measure the outcomes.
Are they going to make a reality show?
We hope so.
Yeah.
I mean, this is not that we want to help 5 small communities. We want other people to say, if those clowns in Clatsop community could do this, so can we. And the goal is to measure it. Now, why isn't it easy? Because it sounds so simple. Well, everybody wants to do a pilot program. 45 people are in the diabetes prevention program. And even in a community of 50,000 people, that's not scale. So people need to be accountable. It's not, Wellville's coming in with a lot of money and they'll pay you to do stuff, and when they leave, you stop. It's, we want to do this ourselves, but do we really want to take responsibility for promising that we're going to reverse transitions to diabetes and create a healthier community? So you have people, again, who have day jobs running public health, delivering flu shots, and you're asking them to launch a full-scale 20,000-person diabetes prevention program. That's what we're trying to do, and we're making progress. But
What about
it's 5 years.
Alan? Have you launched any Vitality Villes?
I mean,
Could be a good idea if you haven't done it. Yeah.
Yeah, and there's no doubt the power of the community is what really drives so much of healthcare and well-being. We take a bit of a kind of a view that the employer is a community in a way. It's where most people are spending the majority of their waking hours. They're there with a whole lot of other colleagues. There's a certain infrastructure that's there. There's enablers or inhibitors in place within their setting. So we approach it from that point of view, is that you've got an employer setting. Let's try and make that employer setting as conducive as possible to living healthier lifestyles.
So let me just ask all of you, comment. We've just had a discussion about data, health, and a lot of it is talked about people and their choices, about community, about the wraparound issues. Hasn't been a lot of discussion about hospitals and doctors and that whole stuff that perhaps has been played out in many places. But it is interesting that I've seen this over and over again. The discussion is moving away from the doctor and services per se, and more to what can people do to make smarter choices on their own and sort of navigating this. And I'm wondering if I'm getting that right. But if I am, what do you think the dimension is still for healthcare providers, data, and the patients coming through? What is the accountability that you're trying to get on that front? Chris?
I wouldn't say that we're moving away from discussing the role that providers play. I just think that we're reinforcing the idea that a patient or a consumer has to own their own healthcare needs, their own health and healthcare
But
needs.
those are different, right?
They are different.
I mean, because I don't want to call them because I'll get in big trouble here, but I'll just say it. I mean, the old system seemed to have been a bit structurally corrupt, right? So you had doctors and providers essentially earning their way by prescribing, by engaging in things, and now we have a more holistic view of what the health track ought to be. That's based on outcomes and not necessarily delivery of services. So there were incentives that were not on the right track before, and so I do look at the fact that actually you've got to have better empowered patients to help be part of that process, or it won't work with a provider.
Right. Yeah, and I think so. What you're hinting at is the move towards more of a value-based system, and I think that's no different than any other industry, right? And you're right, moving away those incentives for the fee-for-service model where they were just prescribing things, or they were basically receiving revenue based on the number of visits that they had from many of the patients, where now they're more encouraged to say, we want you to own your health, we want you to take care of yourself so that it lessens the number of times that you have to come see me, and then, of course, they reap the financial reward from that. But I think, so I wouldn't say that we're moving away from focusing in on providers and that need to have more of a value-based model. I think where we are is just focusing more on the idea that the patient should be empowered, and thus, and we're going to do that through the form of getting them information. I think I differ slightly.
Use your notes.
I differ slightly from Esther as far as people not wanting all of the data, which to a certain extent I do agree with. What they want is more information. I do think people want more information. If you look at every panelist on here, we all have Apple Watches, so we actually want some information about our health, or else we would just be using a basic Timex. But generally, I think that the move towards a value-based system is inevitable.
But we are, forgive me, we're all upper middle class, well-educated people.
No, you're upper middle class. I'm joking.
Yeah. You can come on the show anytime.
No, I mean, what's really interesting is the healthcare system is being incentivized now to go outside itself, and they have community needs assessment. They have to spend a certain amount of money on community health. What we're trying to do is help them change it from handing out brochures to actually getting out in the community and doing the kinds of things we're talking about. Mm-hmm. But it's not unique to hospitals and providers. Even the, quote, demon pharma companies are saying, instead of selling pills, we're now treating rheumatoid arthritis. Right. And they're using data to follow the patients, starting with diagnostics, then with treatment and management through the disease and tracking outcomes. This whole notion of first you make a pill, then you have the FDA, and then you have no idea what happens is changing dramatically. The regulatory system hasn't quite caught up. Every pharma exec tells me I don't like to talk to people taking my drugs because if they tell me I had a headache, I have to tell the FDA. But using data in that way, tracking longitudinal things, whether you're
so
pharma
are we getting there? I mean, because it seems to me, again, I may be off, and we're going to go to the audience soon and get your guys' take on this, but it seems to me that there's this weird arbitrage situation going on right now where I agree with you totally that there's a literacy on this stage that does not replicate the profound illiteracy about health that much of America has in terms of knowing it, because you've essentially subcontracted that out to your doctor or to your healthcare provider to think about that stuff. But in Vitality and what you guys are looking at, the quantified community, the quantified person, the person chasing points, the Apple Watch wearer, is that there seem to be at least some who are getting more in touch with that arena. That's still tip of the iceberg, but nonetheless, it seems like it can potentially change the game in terms of the information power in that relationship, right? And so when you look at that ecosystem of players, when you look out 10 years from now, Esther, how different does it look?
Well, I do hope every little grade school kid will have a device. Mm-hmm. We'll be measuring their blood glucose, and we'll have, just in class in second grade, we'll have understood the difference between a cupcake and some oatmeal in terms of what it does to their metabolism.
Which is better? The oatmeal is better.
Yeah. They will have had, they will have tested different diets on mice, and maybe one of our schools gets sued by PETA, the treatment of animals people. But kids will take that for granted. They're not all going to be awesomely healthy. With luck, healthy food will be cheaper. Unhealthy food will be harder to get, and that is the change we want to see in our communities. We've got a 5-year time scale plus probably another 5 years. And it's not that everything changes, but being healthy should be normal. You shouldn't have to be lucky to be healthy.
So before I jump into the audience here, but let me ask maybe Chris and Ellen, one of the things that data should do beyond the relationship with healthcare is in science and advancement and research, that when you're getting aggregate amounts of data on a big swath of people, you're going to see things like in The Matrix, like Keanu Reeves, that you didn't see before on cancer or on behaviors or on whatever. And is that happening now? Or if it's not, how far are we away from those giant transformative realizations?
My personal perspective is that we're in the nascent stages of truly understanding this concept of population health. Many of the providers who sit on mounds of data are looking to draw these conclusions from the aggregate data sets that they have. But it's funny because on one hand, we're pushing this notion of population health, but then on the other hand, people are talking about precision medicine. And they're saying that your genetic makeup is different than mine. Thus, even if they're looking at this generalizable approach, it may not be applicable to both you and I. So on one hand, as
But
providers,
couldn't both be true?
it could be true. That's right. I mean, and so on one hand, and I think what Esther is hitting on when she talks about the idea of fresh fruits and vegetables, I still think there's a challenge of access to those things in the food deserts, but that's a different topic. So I think there is a movement towards population health with the aggregate data sets, and there's also this movement towards precision medicine for those that are battling any chronic diseases or the like.
Alan?
I think the amount and quality of the data that we're sitting on now is, I think it's extraordinary. There's been so many studies now, huge longitudinal studies, proper peer-reviewed studies, with hundreds of thousands of years of data correlating the effects of lifestyle and mainly on mortality, but also to an increasing extent on morbidity. So showing the effects of healthy living on key lifestyle diseases, and we're now at the stage where can we bring this down to the individual? Because I think there's a very good understanding at a population level in terms of these things. But how do you translate that into something that's going to give the individual real, in-the-moment power to make a change?
Is it your experience that once people are in this, that they really do move?
Absolutely. And obviously, it's not everyone that's going to be motivated by it. People are motivated by different things. Ultimately, you need things to be driven through intrinsic motivation. So you want people to be doing things for the sake of getting healthier, but that's a bit naive. So these external motivations, they do work.
Esther?
The thing that I've learned many, many things in the last 2 years, perhaps the most important that is being spread more generally as well as ACEs.
Is what?
ACEs, the adverse childhood experiences. There's a little scale of 1 to 10. And things like being abused, losing a parent, seeing violence. These things are cumulative, and they have a huge effect on mental health, which has a huge effect on physical health and vice versa, of course. But it's, there's your genetics, and then there's the stuff that happens to you. So that we're doing something in several of our communities, and we hope in all of them, training teachers to respond to kids who are behaving badly, not as if the kids were sent there to torment the teachers, but that the kids themselves are in torment, and how do you help them cope? You can't change what happened to you, but you can change your ability to deal with it.
So, again, I promise I'm going to, but I mean, it's such an interesting question. Ta-Nehisi Coates has written this book that's getting a huge amount of attention. One of my colleagues at The Atlantic called Between the World and Me. He's written about incarceration, and there's just a huge swath of the population in which the world you're talking about is there. It sounds to me, I mean, just to be very, not to be impolite to Ta-Nehisi or others that are in this area, is that there's a huge amount of drama and trauma and whatever there. And so when you talk about teachers and others engaging it, it sounds like that's soft and fuzzy to me, inconsistent across platforms, very different. And so when we think about data and science and coming in with some, is there a tension there? Because I agree with you that it's an issue, but when you get back into the data and you look at the problems with healthcare today and sort of inconsistent service or inconsistent outcomes that data should fix, how do you then move into the world of people who've seen violence or had bad things happen and develop a precise level of engagement that generates outcomes that matter? Because it sounds to me we're going down a slippery slope of kind of fuzzy imprecision again.
No, you use the data to say, this is not fuzzy. This is something bad that happened to this person, and it has an impact. And the precise impact is going to differ depending on a lot of different factors, but statistically, it's real. It's not at all fuzzy.
Right.
But at the same time, the reason this matters is, if it were a thing, it would simply break. It's a human being. It's complicated. And a range of, it needs human beings to solve it. The whole point is a computer cannot fix this. It's a loving human being that the kid can trust.
So there are limits to robots.
Yeah, and sorry to be fuzzy, but
So,
we're all fuzzy.
Chris?
Yeah, I want to address this point of precision, and it always concerns me because, we're going to ask the same questions that we've been asking, even though the data itself is robust enough to introduce new questions, right? So it's like we're not smart enough to know the power of the data that we have in our hands right now. And so, sure, you can get a precise answer to a question you asked that you've always asked, but that doesn't necessarily mean it's accurate, right? And it doesn't mean it's an accurate depiction of the community as we talk about these different communities and all the factors that truly influence it. We inherently presume that we know what the answer is, and we're seeking to validate what we think we already know. And that's always my concern. So when people are looking at data, whether it's related to incarceration, whether it's related to graduation rates and all these things, we're just saying we already know what it is. I just want to see if this data is going to validate what percentage of it is actually true or not. And we're not stepping back and saying, really, what is going on here? And until we really look at the data for what it is, and then we're basing our public policy on that data, we're going to constantly be in the same
So Chris
situation.
runs something called the Health Data Palooza, and he's a manic data embracer, and I think I'm actually a more manic data embracer than you after what you just said.
Okay.
I see greater value, because I think data is disciplining, that over time, data comes in and whacks bad performance and elevates and focuses empirically on good performance. I mean, that's what, so when you bring them together, so data that comes on that maintains obscurity or inconsistency, that seems to me stupid. Why would you basically, you can be stupid and inconsistent without data? Why bring data in to reinforce those trends?
No, so let me clarify. I am a big believer in using data. What I'm not a believer in is using traditional or conventional methods in order to ask specific questions. I think that we have to take a step back and really ask ourselves, are we asking the right questions for the situation? And so what I'm saying is that there are inherent biases that each researcher is proposing with that same data set, instead of looking at it and saying, oh, well, let's think about the questions that we're asking to ensure we're getting the right answers.
Okay, I'm hoping someone in the audience can take us deep out of the weeds that we're in. But let me open up the floor and comments right here. Noel.
Yes.
Noel, are you in the Vitality Point system? You look really healthy.
No, but I'm looking.
Yeah.
A nice suit, by the way.
Yeah.
Oh, okay. Stand up also? Okay.
He's fashionable.
There are
too.
millions of people watching online right now.
You get to see my back. When I look at data, I guess I look at it as two pieces. One is data for the scientific community, for the public health community.
Right.
And all of that is important. Dive into that, see what the trends are, make sure we can pull out all the biases that inevitably are in there. But my question is more focused on the consumer use of data. So whether it's the Apple Watches on your hand, the Fitbits,
Right.
I'm a bike racer. Everyone who I bike race with follows keeps track of their watts and what have you. And what I see happening is that the most important things are the most difficult to measure. And the most important things are, as you pointed out, kind of the fun, the life fulfillment, things like that. And just your thoughts on what I see happening is that the consumer is being drawn into this rat's nest of data, and it's creating stress, neurosis. A lot of times the behavior change, as you point out, Chris, is not long-lived. There's obviously
you're
a whole
asking-
industry that's pushing it. What's kind of your thoughts on that?
So you're asking the happy face question. Remember, on some of these Fitbit things or whatever, Jawbone, you get on and it says, what's your mood today? Which I
Right.
find the most interesting and probably, so that gets into the kind of quality of life. Whenever
Right.
I see it, it puts me in a bad mood because I feel
Right.
I have happy face
You'd be happier if you
allergies.
threw off your Fitbit and didn't wear it for the next week.
I
so
work
you
for
wouldn't be
Richard
reminded
Nixon.
of
I think they're
yeah.
related there somewhere. But in any case, what about the broader question of, are we measuring the wrong things? How do we get to the point of measuring the right things? Is that fair?
Well, I mean, I think the bigger question is who's determining what's the right and wrong things? I mean, again, it goes back to the point of we would be measuring what we've always measured before. And we're saying that measuring quality of life is difficult because how do we define quality and how do you define it and how does it apply to you versus how does it apply to me? There's no
But
universal.
there's got to be generalizable things. I mean,
There should be.
I'm going to throw this to Esther because you've just made me think about a great article. Would be if I wanted to design a track to become a totally neurotic unhappy person? What would be the things I'd reward myself and give my points to do, right? Because if you think about what the supply chain is of misery, maybe it would be smarter about the supply chain of health and happiness, right?
But maybe, again, it's like so many other things. Some people use alcohol to go out and have a good time with their friends.
Right. Some
people become addicted, and some people use alcohol to go to parties and network and sell insurance. It's like
Ding.
all these things that are empowering can also be overused, can become addictive.
And can be different across the, as Chris just said.
But self-awareness in general can be helpful. It's self-awareness about when I don't sleep well, I argue with my spouse, or when I eat pastry for breakfast, I have a hard time paying attention at the conference later on in the day. When my kid watches TV late at night, they're obnoxious the next day. These kinds of things, they're short term. But understanding cause and effect and then starting to apply it to yourself, the feeling that you are being manipulated is what so many people have. They don't really understand how, but they sort of know that they're not in control.
Alan?
Giving them something that lets them control themselves gives them that empowerment. Sorry.
Alan?
Yeah.
And I wasn't talking about you when I mentioned insurance.
I think this is, at the end of the day, this is a consumer-led movement.
Right.
It's not government coming in and saying, thou shalt wear Apple Watches and measure all your steps and so on. There's a bit of a groundswell, bottoms-up movement towards this. People are embracing this whole notion of self-quantification. It's helped by the fact that the technology is becoming increasingly cool. And there's also the whole social media element to it as well. So just knowing that your colleagues are doing things, measuring and putting values out there or measures out there, that has an effect on getting other people to do it as well. So I think it would be quite different if you're coming at this through coercion. One must realize that people to some extent do want this type of thing, to a large extent do want this type of thing. It may in some ways be driving them a bit mad. Data does have the tendency to overwhelm. The artistry here is to be able to work out which tools are going to present this in a way that's
even smiley faces.
That's going to be simple and meaningful.
Chris, quick thoughts?
There's a lot of thoughts,
Yeah.
but I think that the self-quantification movement is real, and as he stated, it does need to be consumer-led. I do think government plays a critical role in it. I wouldn't understate that. I think there's a tendency for people to want to believe that they want less government involvement or intervention, but public policy is driving a lot of the key things that we're talking about today.
Right.
And whether we want to credit government with it or not, it's the reality. And so we wouldn't be talking about precision medicine unless the White House made that announcement several months ago. We wouldn't be talking about population health or value-based or the movement towards a value-based model unless Secretary Burwell announced it several months ago. These are realities. And so, but should it be solely and singularly focused on what government is doing? No. But we have to realize that legislation and regulation play a huge role in driving the other actors to actually adhere to these things.
I just want to say before I go to the next one, Noel, they're in the private sector space somewhere around 250,000 apps that you can get in the healthcare space today. It's ridiculously large, but it shows the richness of what's going on out there of attempts. And not to drop names because I don't watch your show, but I was having a dinner the other night, and at the dinner was the nutritionist for Oprah. And I had very low expectations hearing that because I didn't really know how she was so informed and so kind of tuned in on these quality of life, but from an informed empirical data thing. And she did put some positive energy into it. I was kind of captivated because I'm usually never captivated. I thrive in cynicism and darkness, but she gave me hope. But I sort of think that there are things going on with people in that space that we should watch out for, that it's not as black and white as I may have let it be. Let me open up to other questions. Yes, right here in the front, and we'll move to the back. And we'll go lightning round. Paul or Evan. Sorry, folks, I have to reward the front row people because it takes guts to be in the front row. Yes.
Hi, my name is Evan. How are you? This is a question, I guess, for Chris, but for the rest of the panel. In thinking about utility of data, I mean, there's what we can get out of the data. We live in this era of a tsunami of data, but we derive little meaning from it. Mm-hmm. My question is this. The data can really only tell us a few things. Right. It can tell us, do this, don't do that, from a personal perspective, broadly. It can say, do this treatment or don't do this treatment, or do some other treatment. It can say, use this hospital or doctor or use some other doctor or hospital, as an example, or it can help providers say, treat patients this way or that way, right? And if we think about those kind of classes of things
right.
that you can use, the data for.
So binary O's and ones.
Well, not necessarily, but I'm just saying those are classes of ideas that you can use the information for. I'd like to get an idea from the panel where we think the biggest utility is,
okay.
And then we have to adjust that for what's the probability of using that data and having success with it, because it's great if, as an example,
Terrific.
we said
Right.
the biggest application for the data is teaching providers that this is the right treatment for patients and you should use that. But if nobody adopts it, then it's not worth anything.
Right.
So with those two dimensions, I'm curious how
Got
we
it.
think about data.
Quick answers.
Well, I think that predictive analytics is going to do a lot of what he's addressing. I mean, this idea of creating this learning health system and constantly improving clinical protocols, constantly improving decision-making or more informed choices from the consumer and the like. That's my quick answer. Sorry,
Yeah, I'd like to push back a little bit. It doesn't say use this one or use that one. It says these are the probabilities.
Mm-hmm. Right.
I get cancer. I have 3 kids. I want to see them graduate from high school. I don't mind if my life sucks. I don't mind if I'm feeling side effects. I want the treatment to live as long as possible. I'm older. My kids are fine. I've got cancer. Just let me live a short but happy remaining piece of my life. So all the data operate in the context of who's making the decision, for whom, about what. It's understanding probability, not just yes or no.
Right here. And then we'll go back. Yeah, you. And then short questions. We're going to do lightning rounds. We're right near the end.
So
and then back.
my name is Todd. I run a company called Sensoka, and we measure Sensoka.
Okay,
Yeah,
okay.
we measure different physiological signals in the autonomic nervous system to measure emotions. And so I'm curious, by way of personal stories. You all have Apple Watches there, and the Apple Watch obviously measures only very few physiological signals. And I'm wondering, what sort of physiological signals would you guys like the Apple Watch to measure such that you can live healthier lives? I recently had a conversation with the director of hardware engineering on the Apple Watch, and she told me that right now it's very, very difficult to get the precision to actually become more aware of these physiological signals. So obviously, with regard to precision and self-awareness, I'm just kind of curious how you specifically use your Apple Watch or will use an Apple Watch with more data to live healthier lives.
So before you answer that, do you know the watch or the sensor company Numa, N-E-U-M-A? So I like Numa. I wanted to just be clear with that. But they lent me one of their watches once. For those of you who don't know it, it measures stress. And it buzzes, and it went off all the time.
Face.
It would just stress me out. I actually wore it at our last healthcare forum, and it was just going off constantly on the stress. So I love this question that you just asked of what would you measure? What would you like to see in measuring your physiological responses, Chris?
You're gonna start with me?
Yeah.
I think stress is huge.
Yeah. You want to know when you're stressing out?
Yes.
Yeah, okay. Get a Numa watch. It tells you.
Well. That's a tough question, because the reality is that, I just love the passive approach of data collection, right? The fact that I don't have to enter anything is the thing that, whatever it is, whether it be blood pressure or heart rate and whatnot. And so the most advantageous aspect of the Apple Watch for me has been, the rare times that I do work out, the fact that it does track the amount of time that I worked out and other things like that, and the heart rate associated with it.
I'll answer your question slightly differently, because the watch isn't going to do it for a long time. But what really I think most needs measuring that is not measured is genuine quality of sleep. The jawbones and stuff just do motion. There was a company called Zio that had a great tool but a bad business model. But it'll come back in some form.
So general quality of sleep, interesting. Yes.
And I'd like to see the immediate predictors of stress. So once you know you're stressed, but what are the things that are leading up to it? If there are physiological indicators that immediately precede that. If the watch can somehow give some type of correct.
Well, Intel has apparently developed some kind of carpet or rug with a sensor in it that over time it can anticipate someone's likelihood of a stroke. I mean, it's an incredible sensor. So this notion of embedded sensors in everywhere anticipating health events is very interesting to me. Is that something any of you have played in?
Yeah, there's a company called Effectiva from MIT that is used for kids with epilepsy and autism and can predict behavior things or seizures and so forth. I mean, there's a lot of work going on. It's simply the devices are still pretty invasive and they're pretty medicalized.
In the far back. Well, we're almost in the far back. We can probably do, can I do like two more, Lindsay? Where's Lindsay?
If we talk briefly.
Yeah, briefly, quickly.
Hi, Greg Wells. I'm involved in data analytics for healthcare. My question
have
is,
you on the panel.
my question is really simple. One thing I haven't heard a lot of this morning is around personal data security.
Yeah,
from
privacy
the
and
public.
data, absolutely.
Yeah, and I want to get, that's an entirely different subject, but my question is, we're all pretty much proponents, I think, in terms of using data and analytics for insights and improving patient outcomes and all of that. My concern around data is a personal or a backlash, a consumer backlash in terms of the use of that data and how it's used. And I'm just curious what your guys
Completely agree. If we'd had another 30 minutes, it was my next wave.
Yeah, if they're just give me your quick overview on it would
so
be
quick
great.
thoughts on data security, the privacy question, and really, because sometimes we talk about privacy as in such a bland way, but you're sort of talking about the real fear that people have that something's going to come get them or bite them or cause problems down the road. Esther?
I think control of data, as opposed to privacy, which I don't know what it is very important. But I also think, and it's slightly politically incorrect, over time it's going to become much less of an issue. People right now go crazy about their DNA because they think it predicts so much. It actually doesn't predict that much. It's important, but again, so is what happened to you when you were 2. But what's really important is how you deal with all this stuff. So I think there will be backlash, there will be lots of commotion, and then we'll sort of calm down. And everybody's data is going to be there, and we're still going to care about Angelina Jolie's data, but not so much about other people's.
Quick answers, Chris?
It's funny. I think that when it comes to health data, people are the most concerned with privacy, but it's proven that the most commonly violated data set is going to be more your banking information anyway, so more the small data. And I would be actually more concerned about that than I would be with the health data. But when it comes to health data, I do think that many of the privacy policies will be modernized to reflect where we are today. Most of it with HIPAA, for example, was written in 1996. Technology was vastly different then than it is now. And also people, as a civic society, view data differently. I agree with Esther that it will be less of a concern with people. I mean, we're giving away our data freely with just social media. So,
I just want to say, just before we go to the last person, I apologize. I know there were people here, but we'll have more time, and I'll go to everybody as in the next session, or Mary Louise Kelly will. I think it is very important to emphasize your point that a lot of people fear this because it wasn't very long ago when people had a health condition and knowledge about that health condition could create lifelong liability or lifelong exclusion in the healthcare system. It could create problems in work. It could create problems in community. We had people with HIV, with other forms of conditions, et cetera, where there was an enormous cost. And I just want to punctuate that point because that was just a couple of years ago. And so even though we've had changes in the environment there are a lot of people who are worried that that's not stable. So it's not a trivial issue when people think about that personal dimension of privacy.
But has it been related? Is it related to information they've given out, or is it related to a breach of health data?
Well, he was talking about health security. I would say it could go either way.
So the presumption is that there's been some security breach in some healthcare system with the health data. It's gotten out that an individual has HIV, and then thus their employer.
These consequences, blah, blah, blah. Yeah. Okay, great. Last question right there. And I apologize. Please forgive me.
Thank you very much. My name is Zora Razek. I've come from D.C., Washington, D.C., for this event. So I'm very happy to be here. I am in the field of public health, and I've done a lot of research internationally, especially in developing countries. I can, if there was time, I could
really quick,
share a lot. But one thing that really I appreciate when Esther Dyson mentioned about the Apple Watch. It reminds me of a story.
But I have like 30 seconds for you.
The U.S. government made a device for a developing country that was battery run to teach them about sanitation, but in village areas. So this device, millions of dollars was spent, but nobody could use it because they needed battery and they didn't have the money to buy battery. So speaking of the Apple Watch, for the upper middle class people and those who can afford it, that's a great thing. But what about the rest of the population? And having said that, I have a suggestion. What about education for kids at school about health? Everything about health, not just what we're teaching now, but about diet, about exercise from a very young age. Thank you.
Health literacy for kids, children, and the broader issue of gadgets, trickle-down gadgets.
Totally agree.
Yeah.
Totally agree. I mean, I think that's a key point that she raised, health literacy, and I would say health data literacy. I mean, we've talked a lot about that.
And yes, plus access to the ability to carry out that knowledge.
And I think gadgets will have a greater role in terms of making an impact in developing countries. You've seen what cell phones have done. They've transformed developing countries. There's no reason to think that.
Yeah, I mean, the phone, the penetration of the
Absolutely.
phone, information delivery on the phone, when you see what companies like Qualcomm or MasterCard or Visa or others are doing either in banking people or, I'm sort of jealous that there are folks in Congo who are using their phone for health apps that I know that we're not. And so there's an incredible array of things here. So I want to thank an incredible panel. What a wonderful discussion. Thank all of you for your patience, and I'm sorry I couldn't get you. But Christopher Boone, thank you so much, with the Health Data Consortium, Esther Dyson with EDVentures, and Alan Pollard, Chief Executive Officer with the Vitality Group. And if you're like me, if you listen to Alan for a while, you have this urge to buy diamonds. But, we can put that aside. In any case, thank you all very much. A big round of applause. Thank you.